listening to the Pharmacy Podcast Network.
The testimonials appearing in this podcast reflect individual experiences and individual results may vary. Cardinal Health does not claim, nor should the listener assume, that any individual experience recounted in this podcast is representative of what another consumer may experience.
The Cardinal Health Counter Talk podcast, in collaboration with Pharmacy Podcast Network, is for independent pharmacists to learn about the state of the industry, innovative services and solutions, and the future of pharmacy. Join me, your host, Jason Calori, for conversations with pharmacists, Cardinal Health leaders, and industry experts, sharing best practices, discussing industry trends, and showcasing Cardinal Health products and services. You can subscribe to the Cardinal Health Counter Talk podcast on Spotify, Apple Podcasts, and wherever you listen to your favorite podcasts.
Hello, everyone, and welcome back to the Cardinal Health Counter Talk podcast. I'm your host, Jason Calori, and today we are continuing our Why Independent Pharmacy series and learning about independent pharmacists making a big impact in their communities, hearing their stories, what they do each and every day, and what is making them successful. Today, we have Erik Hudson, pharmacy manager at Western Medical Equipment and Drug. Western Medical Equipment and Drug is an Oklahoma-based family-owned business with 7 pharmacy locations, 5 medical supply locations, and over 90 employees. Erik, welcome to the show.
Thanks for having me on.
So how are things in Oklahoma?
They're great. It's a beautiful morning this morning. I will say one of the neat things that's been kind of going on in this area is there's some devastating wildfires out to our west here recently that affected and impacted a lot of farmers. And there's just been a consistent line of hay trucks heading out west of just donated hay, trying to help the farmers out in our area be able to feed their cattle and their livestock right now. So it's a good time to be an Oklahoman, and we're seeing kind of the pay it forward going on right here locally. So
that's kind of a nice lead into helping each other in the community, basically what we see independent pharmacists doing all the time. I really want to just start with you and just say, what led you to becoming a pharmacy profession, ultimately getting into pharmacy management? I'm not sure what your percentage of behind the counter versus, not behind the counter at all versus the management part that you're doing. So tell us a little bit about your story, how, what got you into the profession, and how your job evolved into what you're doing now.
Sure. So the first, to answer your first question, I work pretty much every day behind the counter, in addition to having the ability to kind of go back and work on some things because I have an extra pharmacist here. So I'm kind of a hybrid. I'm always filling in for some of our other stores that might need me at any time for vacations and that kind of thing too. So I'll paraphrase or kind of abridge this as much as possible, but I didn't have the traditional upbringing in pharmacy that a lot of my peers did in college. It seemed like a lot of my peers, they may have started in working in a pharmacy at a young age, or they may have had an uncle or an aunt or a dad that owned a pharmacy, and they kind of grew up in it. I didn't have that upbringing. I grew up in Northwest Oklahoma in a little town called Buffalo. And we had about 1,200 people there. The whole county has about 3,000 people. So that gives you some context of how rural we are.
Wow.
I grew up working agrarian jobs because that's pretty much what was available, So I drove a tractor. I worked at a local farmers cooperative. I unloaded wheat trucks, that kind of thing growing up. So, but I had a really great family. My parents were super instrumental in my life. They really we didn't have a whole lot, but I never wanted in life. And, but I was never given everything either. And so, I kind of grew up with work ethic and that kind of thing. And that got me a long ways in life. Not to go too far into this, but I do want to give you some of my family history. My grandfathers were really instrumental in my life. They were important men in Northwest Oklahoma in this area. One grandfather, he grew up about 3 hours west of Buffalo. For some context, if you think about the panhandle of Oklahoma, he grew up in the very, very tip of the panhandle. And back in the 1930s, if you know the area, that was the center of one of the the greatest ecological disasters of our lifetime, which was the Dust Bowl. And his father died when he was 6 years old of dust pneumonia, and 13 kids grew up in a little bitty shack in Boise City, Oklahoma.
Oh my gosh,
And
13 kids.
13
Wow.
kids, a single mother. And they grew up, they actually had to retrofit a chicken coop, wall-to-wall mattresses, and all those kids grew up, and they all, somehow made it out of that. And so with that, my grandfather actually got a football scholarship, and he went to Oklahoma Panhandle State University, worked his way through that, got an education degree, ended up getting a doctorate at the University of Oklahoma, and became a superintendent of public education around the area. And so he just kind of traveled around and did that. And he always just wanted me and pushed me to get a degree that was would make a difference. And so he always kind of pushed me from that side. On the other side of my family, my other grandfather was actually a family physician, and he started a hospital in Buffalo back in the 1960s. And he was kind of your old school country physician that, carried the black bag, and he took care of people. And that's all I can say about him is he would trade medical care for, whatever you could give him, chicken, beef, eggs, that kind of thing.
Yeah.
And so he was always, he was a neat man, and I learned how to have empathy and take care of people, and just what it was like to love people, really. And so with that kind of that background, both my grandfathers wanted me to go do something. We had a pharmacy school that was 2 hours south of Buffalo, and so that's kind of where I went, and kind of the rest is history. As far as going into management goes, I don't think that I ever really just went and looked to become a manager. I think it just kind of worked out. And I think, as any independent pharmacist knows, you kind of want your store to be a conduit, an expression of what you care about and what you love. And I think that that's kind of how that evolved.
Yeah, I mean, to me, just hearing your story, it just sounds like you always had that in you, wanting to do more and wanting to, like you said, kind of, I'm not going to say mimic your grandfathers, but at least make them proud in a way where, like you say, you kind of embody the community and what you want to be. And I think that's quite admirable. That was a really cool story, man. I appreciate you for sharing that. Well,
You bet.
I mean, tell us about the network of pharmacies and the medical supply locations that Western Medical Equipment and Drug, and the types of services you guys are offering to patients in order to take care of your community.
So we do have 5 locations, and 5 medical supply locations and 7 pharmacies. We offer everything that under the sun, pretty much. We offer anything medical supplies, so oxygen, wheelchairs, walkers, crutches, canes. We offer incontinence supplies. We do the diabetes education. We do Dexcom. We just recently started doing that with Medicare. On the pharmaceutical side, I actually do the Dexcom setups. Because it kind of meshes well with what we do on the pharmacy, with adjusting insulin and that kind of thing. So we also we deliver a lot. We provide to some of the most indigent residents in Oklahoma, and so we work with Medicaid Advantage. We work with case managers, making sure that those patients are taken care of all throughout the state.
You have a different contingency of patients in those different areas, or is it different? Do you see people needing different things in each of those 7 locations that you have to prioritize?
Good question. So on the pharmacy side, I didn't go into a lot of that, but most of our pharmacies are actually located right in Northwest Oklahoma. Our medical supplies are kind of spread throughout. We have one actually in Eastern Oklahoma, one in Midwest City, Oklahoma, which is a suburb of Oklahoma City, and then the rest are kind of west and northwest. It's similar, but it is different. Some of the things that we offer in Midwest City are unique to that area. We don't do as much of one thing as another because, primarily in Northwest Oklahoma, we are the only provider of a lot of those services. And so if we don't have kind of everything in that area, if that makes sense, then people are driving 3 hours to get care. So we have to be a little bit careful with that or cognizant of that. And maybe we carry some different supplies that maybe isn't a niche in other parts.
Interesting. Yeah. I think another important angle to what you guys are doing that we have to talk about is your implementation of a robust immunization service and how that's been working. What does that process look like, even just beginning that, going from really focusing on the medical equipment side and then getting into implementing immunizations? I think it's obviously a lot of pharmacists have done this since COVID. Maybe the ones that haven't even done any immunizations before got into it during COVID, and it's really blossomed in some areas and in some stores. A lot of pharmacists we've talked to have just really kind of taken the bull by the horns and just really expanded it into, I don't know, I think services that they never thought they would ever do before. What has that been like from your perspective?
Absolutely. So I'll give you some background. I graduated pharmacy school in 2010, and we didn't have immunization services actually at that time. In this area, there is one large chain that was offering immunizations, and honestly, they had developed a little bit of a de facto monopoly on the service. A lot of times, as pretty much every independent probably knows, is the first to do something is usually the one that becomes known as the provider of that. And so I remember the first year when we actually implemented the immunization services, a lot of our patients were coming to us to get their medication, but they were going to the competitor to get their vaccines. And so I would assume that, by now, pretty much everybody that listens is an immunization provider. What we did was we wanted to get a little bit, we had to get out in front of that a little bit because, we were behind the 8 ball on that deal. And so what we did was we started to contact businesses and organizations. We contacted the local city, and we contacted the senior center here in Woodward just to see if we could provide immunizations, outside the pharmacy. Probably most people also have some kind of clinic that they provide like that. But what made us a little bit different, I think, was searching out some local charities and giving back to charities and advertising that 10% of our flu vaccine was going to go back to charities. And when we started to do that, we started to see some changes in the receptiveness of us being able to get into some of those places where we weren't necessarily able to get into previously. And it kind of blossomed from that. So, COVID, it changed a lot. It's changed so much about what we do, and that it's opened so many doors and so many opportunities beyond, what we probably ever imagined. And so hopefully that continues. But
So you mentioned kind of a charity, tie into what you're doing. How are those charities selected as beneficiaries from you guys, and and the flu vaccine program? How's that work?
yep. So in Woodward, we don't have a whole lot of charities, but we do have, we have 5 or 6 nonprofits that operate in our community that do tremendous things, not just for Woodward residents, but for all of Northwest Oklahoma. We have a youth shelter that takes in disaffected youth. We have homeless shelter. We have the food bank, which has been super instrumental since inflation has just impacted so many people living on fixed costs and fixed living. And so, we seek out, who we feel is the most in need. The last couple of years have been the food bank. If you drive by our local food bank, there's just people there all the time, people that need. And so, really, we just select based on where we think that money would go the furthest in that year. And again, we give about 10% of our vaccine profits to that. And it's been great. It's one thing to write a check. It's another to get involved. And so, I think that also opens doors to actually becoming involved, getting out there and helping those charities out as well. So, we encourage our staff to do that. We encourage our other pharmacists to do that, and to truly try to help the community.
Yeah, it's that pay it forward mentality. I think that's kind of just ingrained in independent pharmacy, and I love that about what you guys do. Let's take a step back here. So when you first started the flu vaccine program, I'm always curious because every community is different, whether it be rural, maybe it be urban, where you have a lot of different marketing tactics, a lot of different avenues at your disposal. How did you start promoting this new flu vaccine service that you were offering? And you said that others had you had gotten into it maybe a little bit late, but what really drove the traffic to your doors?
A couple of things. First off, we kind of had to go get it first, and so again, we made some cold calls. We started calling around, and then we had some things fall into our lap as well. So one of the physicians, as the high dose, the flu zone high dose, and the different 65 and older vaccines came available. Some of the physicians actually didn't have those products, and so we actually would call them. We had a patient or two walk in and say, "Hey, my doctor didn't have the flu shot he wanted me to get. What do we do?" And so we called him and said, "Hey, we've got all the flu dose you need. Just send all your patients down here." So a lot of that was just just listening to the customer as they came in and finding out opportunities like that to kind of drive that traffic. Another thing that we do and that I like to do, when I give vaccines, I like to take time, and I don't like to just push the customer out like they're going through the cattle chute or something. I like them to come in. I like to talk to them.
Yeah, absolutely.
Ask them about their health. Find out if there's other avenues. I can't tell you how many times I've had somebody come in for a vaccine, and we end up kind of referring them to our packaging, or getting us set up on Dexcom. You talked a little bit, or you asked a little bit about, kind of the advantage of having the medical supply. We're also able to use some of the data from our medical supply to kind of drive some of those things that we do. So anybody who comes in for a CPAP or a BiPAP setup, they're prime candidates for to get them set up with immunizations or respiratory immunizations, anything RSV. Market that to those customers. That is a huge advantage for us. Also, anybody who may come in for a CPAP likely has a comorbid condition. And so, maybe they have diabetes. We can market our Dexcom G7s, that kind of
Mm-hmm.
thing. So it all kind of works together, and having that data is definitely advantageous.
So that's interesting. At what point did you notice that your medical equipment and your flu vaccine, your immunization services could really overlap? And, when did you really feel like you can use that to your advantage?
It took longer than it should have, to be honest with you. It didn't come, really honestly, it came when we started to do Dexcom setups, and it kind of, we kind of had an epiphany that, hey, these patients also are sleep apnea patients, and then it was like, oh wait, vaccines, with RSV, these would be great. These would be great patients to market that to as well. And so it took longer than it should have, but we're there now, and so we're trying to use all our resources and things that are available to us for that.
What have really been the long-term results, you think, from basically when you instituted this program? You have a lot of different layers to it, not only, as we just talked about, the charitable portion of what you do, but also, like we just talked about, the kind of the mutual tie-in and overlap between that, bringing people to the pharmacy. I mean, I would just imagine that, your community, has your community seen you more of a all go-to pharmacy destination?
It's hard to quantify. It is hard to quantify, but I will say that it not only opens the door to, obviously when you give a flu vaccine, you can offer, pneumonia vaccine. There's just so many different variables there.
Mm-hmm.
But it's an expectation, right? People expect to be able to get a vaccine at a pharmacy now, and so you have to meet that expectation, because if you don't, then they're going to go down the road, to your competitor. So I don't know how to quantify it, but I will say that, it's been super helpful in helping the whole patient, and not just not just one service. And so, we see a lot of people who come in for a vaccine and then end up changing their medication over. And I always tell my staff, if we can just get them in the door once, we can keep them. And I think that a lot of independents are like that. Just get them in the door once, and they're yours, because they notice a difference, and we can take care of people different than others can.
So let's talk about long-term effects of everything that you had instituted in your pharmacy. You have obviously this vaccine and your immunization program that you have pretty much developed over time here, the charitable part of it, and then obviously the tie into your medical equipment program. So putting all those things together, long-term, how has this, kind of affected your pharmacy, not only from a business side, but almost an emotional side, I think, for your community and even for your staff?
So our staff I'm so thankful for them, first and foremost. They have always embraced any changes that I throw at them, and it does change. Anytime you change something, the impact is felt usually with your staff, and they love the program, first of all, and so they want to not sell vaccines, but they want to push vaccines, and they want people to get vaccines with us, simply because they understand the charitable part of what we do. It's good for us. It's good for our community. It's good for employers. Emotionally, I think that we get lots more buy-in
Mm-hmm.
from our customers, and so the buy-in is a big part of the program that we offer.
No, that's awesome, man. I could see you getting a little emotional about it, just trying to think about it, because I could tell, your staff and everybody involved means a lot to you, which is great. I mean, it's what a lot of people don't see that happens behind the counter. It's not just creating and offering, filling prescriptions
Mm-hmm.
and doing it's the little things that you guys do, and that's what I really kind of
Absolutely.
wanted to. Yeah, that's what I wanted to really kind of, I really wanted to pull at that thread. So let's get into your best advice here, because I think you have an interesting platform to talk about this from what you've done. What advice would you give to a fellow independent pharmacy manager or owner looking to implement immunization services in their pharmacy? I think, there are still a few that could be a little apprehensive about it. Give
Sure.
us maybe your elevator pitch.
Yeah. So first and foremost, a lot of our hesitancy at first, and again, being a medical supply, we rely a lot off of referral sources, and so, we felt like we were concerned that we would be taking away from the physicians that actually feed us referrals, which turned out to not be the case. Many of those referral sources were referring people to get flu vaccines with us. Like I said, that the one physician who didn't order high dose vaccines that one year, and so that's certainly not a reason. Besides the fact that now, a lot of vaccines are handled through Part D and not Part B, and especially since the Part D vaccines are covered 100%, like Shingrix and RSV, and so we have seen that actually is the opposite, if that makes sense. And so, obviously, the DIR impact, no DIR fees, would be a huge deal. One of the things that I'm actually finding, and I actually, right after this call, I'm going to be going to a nursing home to do COVID boosters. But one little piece of advice is, if you go on Medicare's website, Medicare has a section there, Medicare.gov. If you go to the nursing home page, there's a place where you can actually view a map of local LTC facilities in your area, or anywhere throughout the state or the United States for that matter. And you can look at their vaccination rates. You can look at respiratory vaccines. So, and they're graded just like we are, right? So that they have star ratings at the LTC facility. So they need their star ratings to be high with Medicare.
Yep.
So I'm going to an LTC facility right after this. I'm going to be giving COVID boosters to try to boost their numbers, because right now they're at a 0% compliance on that. You can also offer other respiratory vaccines that impact their scores too, like RSV, flu. And so, man, there's just so many opportunities out there that just like that, and anybody can see that data. I mean, it's all out there. So, I always think go get it and don't wait on it to come to your store, really. So,
yeah, that's really good advice. All right, last question for you. I know you have to go help some people with some vaccines.
mm-hmm.
Why do you think it's important for independent pharmacies to establish themselves as healthcare destinations in their communities? For you have so many different facets to what you do. And we talked a little bit about the effects of not only your business, but your staff, your community. Why do you think it's important?
In the past, since I've been a pharmacist, there's been a tremendous commoditization of what we do. I'm not sure if commoditization is a word, but there's been this marginalization of how we're paid and what we're reimbursed for. And I'm not going to go into the weeds on that, but I just want to take you through a little thought exercise on that question, because I can't imagine a world where, independent pharmacies, there's just certain things that a chain, a mail order, they just can't do. They can't meet. Human nature, humans need personal care. They just do. And there's certain things that, over a telephone or over they just can't provide. And so this world needs independent pharmacies, whether they realize it or not. They do. And so, becoming a healthcare destination is really about, we're so important in the community, and we offer, just so many things that you can't get through mail order. And so, I over the past maybe about 20 years ago, I'll end with this. But 20 years ago, Medicare changed the way that they did paid for certain services from the DME, and so they implemented something called competitive bid. And when competitive bid came out, a lot of mom and pops went out of business. And so when that happened, they tried to fill that void with mail order and with unpersonalized service, impersonalized service. And when they did that, they realized that their error pretty quickly. And so after all these businesses had gone out of business, essentially, there became a huge void and really desert of medical supply providers. I'm afraid that, if you don't diversify, if you don't create yourself as a healthcare destination, you may be a casualty of the times. But I think if you can get through this time, I think that it may take, some people going out of business for people to realize the value that we provide. And that's unfortunate. So you got to make sure that you're the person that survives this, because I think that there will be like really, really great opportunity on the other side of this. And so, creating yourself as the guy to go to, or the girl to go to, that's about survival. And I think that on the other side of that is a huge opportunity, and maybe even provider status, who knows? And so, just staying out in front of it and keep fighting and that kind of thing. So.
Yeah, totally love that, Erik. I really appreciate that. And like you said, we'll end it there, because I think Erik really said it all. So, Erik, I really do want to thank you for joining us today on the show, sharing all the amazing things you're doing, and obviously all the great advice you have for the other pharmacists listening, or anybody else listening. I think what you said there in the end is extremely important. So to all of you listening, thanks for subscribing to the Cardinal Health Counter Talk podcast. We really hope you enjoyed today's episode. If you haven't yet, make sure you subscribe and download the Cardinal Health Counter Talk podcast wherever you get your podcasts. See you on the next episode. Take care, everyone.